Thank you, John. Good morning, everyone. Delighted to be here. I think last year I couldn't make it, and today I can see that there is a lot of friends, Dr. Manuel and Dr. Ali, and a lot of ministers and a lot of attendees from permanent missions from different countries. I think every year we're getting more crowd and more coalition. So I think we need to. I've been working like 10 meetings every day since the last 3 or 4 days, attending different activities within the UN. But what happens is most of the time we are talking about things that really very difficult to achieve. And people are talking in different concepts and different backgrounds and not respecting or not considering the culture or the capabilities of different countries. When they talk about universal health coverage, for instance, when they talk about primary health care, when they talk about climate change, there's a lot of topics that we've been through during the last 3 or 4 days. My point here is we have a success story here in this hepatitis elimination program. If we just followed or we worked in a solidarity, I think we will achieve great success. And so it's not about talking and about meetings and about people gathering to each other and about traveling different places, but we have an example, and as my colleagues just mentioned, and we worked hard in Egypt according to our capabilities, which is not that much. We didn't have that much money, but I will share with you some of the activities that we've done. Maybe this will be of value of any. But allow me at the beginning also to say a few words about Dr. Harvey Alter, because of him we are here today. Because of this guy, when he discovered the non-A, non-B virus. So thank you, sir, for coming. It's always pleasure, and you are inspiring all of us when we see you in this important thing. I remember those days when Egypt suffered from hepatitis C, and nearly all families, in one member of each family, they have a hepatitis C patient in their family, and they are devastating and suffering and in pain and in agony and costing a lot of money. So just to take that from one step of the most prevalent country on earth suffering from hepatitis C to the #1 country applying to the WHO for the golden tier of hepatitis C virus elimination, I think that's a model that should be studied quite carefully. And again, we've done that with no big deals, with no big money, with no big capabilities. I have to also talk about John, because I think John Ward did a very good job in putting down the UN group of friends when he bring this idea, and even the Lancet magazine recognized that last year, and to show the solidarity for hepatitis C in the UN group of friends. But let me take you through this important journey of what Egypt used. We started during the serial surveys in DHS in 2008 and 2014. We've done this demographically in all over Egypt, in the 27 governorates. We tried to screen as much as we can in different countries, in the different areas of the country, according to the DHS survey, and we started doing that from 2008. So it has been like around 15 years now since we started our program, and that's in the time of history is not too much to eliminate or to eradicate disease, a global disease, global disease that affects a lot of people, that kills a lot of people. So we've started by having treatment centers, which is more than 170 treatment centers, and we managed to screen 63 million people for HCV during our 100 Million Healthy Lives campaign. And for a home view that are not familiar with the 100 Million Healthy Lives campaign, this 100 Million Healthy Life campaigns is not just for communicable diseases, but it's also for non-communicable diseases. So we've done a lot of surveys for more than 60 million Egyptians all over the governorates. And we happen to facilitate 7,468 health facilities between primary health care, secondary health care, and tertiary health care. So that will be the point of care for those cases. We trained and we worked with more than 60,000 healthcare workers in this program, 60,000 healthcare workers, and they are all well trained to do that during our campaign. And we used screening methods at the beginning, but in order to make the more valuable diagnosis, we also used more than 70 labs of PCR, more chain of PCR labs all over the Egyptian governorates. And most importantly is the pharma industry. As John was talking about, this encourages the pharma industry to work with us. And we had like 15 generic products coming out from our pharma industry to work to facilitate affordable treatment. And that's very important when I talk about affordable treatment, because sometimes the treatment is so expensive that nobody can do it. So I think, I don't know who's, I cannot hear, I cannot see what you're trying to do something? Huh? I cannot see that. Okay. So, as I said, I mean, we've done the pharma industry work with us, the capacity building. We worked with other countries, and this is important because now we work in the political leadership in hepatitis elimination, which we call it the health diplomacy in this area. I believe what we've done in different countries, especially in Africa, like 6 African continents. We work with 100,000 doses of HCV treatment and 100,000 diagnostic tests with our sisters and brothers from Africa, according to our presidential initiatives to work with our African continent. And even beyond Africa, we work with the Asian countries also, and definitely with the UN Group of Friends, and working with the fund pledging conference that John is adopting. So, can you change that?
Can you change, please?
I think they cut for me the. That's another way to. Thank you. So the marathon of hepatitis elimination in Egypt started by political commitment, which I think it's very important to have a political commitment. And that's what happens between 2006 and 2018 when our president decided that we are going to put all the resources for this problem to happen. So political commitment is very important, and that's what happens by prioritization and putting all the resources, resource mobilization. I remember that we've been funded by the World Bank, but the first dollar of the World Bank came after we finished our program, so we managed to work with our own budget. So we engaged all the stakeholders, and global harmonization was also very important, and depending on government funding, and that's a key issue for success. Political commitment is not enough if you don't have a Minister of Finance that is ready and understanding that this is something that will save money for him, because every dollar you pay now will save a lot of money later. And definitely people-centered integrated program, and improving the capacity of the healthcare workers and the commodities, because you can start a program, but in the middle of the program you will out of supply, which we see it everywhere. But how do you sustain and maintain the commodities and the supplies for the whole program all over Egypt? That's another challenge. This is what happens. In 2008, the DHS, and Egypt at that time was 75 million. Our HCV antibody was 14.7% of the population showing antibodies to HCV. Of them, when we go for an HCV RNA and PCR, 10%. And just simply with the age group 15 to 59, we're talking here about around 6 million Egyptians confirmed to be positive HCV RNA. Going to the DHS in 2015, you can see that the numbers decreased to 10%, but that's not because of the of the number, but it happens because of the patient aging and the IPS measures. So the prevalence declined to 10% for HCV antibodies and 7% for the viremic patient. And when you go to when we started our program in the 100 million SAHA in 2018, I'm sorry, now you can notice a dramatic decrease in the number of antibodies and the number of confirmed HCV RNA. And last year, just last year, when we reached 103 million of the Egyptian population, the figures went down to 0.38. So we started by 10%, and now we ended up by 0.38. That's a dramatic change. And you can see here in 2022, where there is an incredible decrease in the viremic patient reaching only 0.38. And when we started 2008, it was 10%. That's a big difference. That's a great success that we have to learn from. And that's why the elimination program milestones was putting 63 million people in total screening, diagnosing 5 million, and treating 4.5 million, and HCC treatment for more than 60,000 for hepatocellular carcinoma. And we've done also a surveillance program for cirrhotic patients. And now our HCC management center went down to 20 because we don't see patients anymore. And that's the good thing about it, because now we don't need to have all these centers of treatment or point of care as we used to have. Thank you, and I'm sorry for taking too much time.